Hey guys, in this video we'll be talking about the tongue. So from the head and neck, the tongue is an expected essay question. So I would like to explain the entire topic of the tongue in a very easy way in just few minutes. So watch the video to the end. Now let us get into the topic. So what's a tongue? So tongue is a conical muscular organ. So where is this located? It is located partly in the oral cavity and partly in the pharynx, that is the oropharynx. So there are some of the parts of the tongue, namely the tip, the base, and we'll be having two surfaces, that is the dorsal and the inferior surface, and we'll be having the two lateral margins. So when you consider this as a tongue, this is the tip, this is the base, these two are the lateral margins. So now let's go to the a side diagram. So when you look it from the side, it appears like this. This is the tip, this is the base, these two are the lateral margins, and the one which you're seeing upper C, this is the dorsal surface, and this will be the inferior surface. These are the parts or the representing structures of the tongue. Now let us discuss each of it in detail. Yeah. Now first coming to the tip. So we have already told like this it will be when you look it from the side. So this is the mandible, here where you'll be having the teeth. This is a maxilla, this is a mandible, and this tip is associated with the incisor teeth. It is directed forward, whereas coming to the base is directed backward, and it is located, it is facing towards the oropharynx. And this base, when you see like this base here, the epiglottis from the larynx is connected to the base of the tongue by means of three folds. Those folds are called as glossoepiglottic folds. So it is connected to the tongue. So glosso from the epiglottis, so epiglottic fold, it is a glossoepiglottic fold. So this is from the epiglottis. One is a median glossoepiglottic fold and two lateral glossoepiglottic fold. On the either sides of the median glossoepiglottic fold, you'll be finding a depression called the vallecule. This is the base and its relation. So once again, the tip is directed forward and related to the incisor teeth, and the base is directed backward and is related to the epiglottis, connected to the epiglottis by means of three folds called the glossoepiglottic fold. There are three in number, one median and two lateral. On the either sides of the median glossoepiglottic fold, you'll be having a depression called the vallecule. What is that? Vallecule, or some say valleculae, anything. So this is about the base. Now coming to the dorsal surface. Dorsal surface. So in the dorsal surface, firstly, as usual, let us see it from the side view. It looks like this. So how is it looking like? It is convex from all the sides and is covered by the non-keratinized stratified squamous epithelium. Non-keratinized stratified squamous epithelium. It is moist and pink in color. So now coming to the features of it. So whenever we draw a tongue like this, there is actually a demarcating structure that will be dividing the tongue into two parts, that is the sulcus terminalis. Sulcus terminalis, it is a V-shaped structure that will be dividing the tongue into two parts, that is the anterior two-third and the posterior one-third. This structure, which is dividing the tongue into two parts, anterior two-third and posterior one-third, is called the sulcus terminalis. This sulcus terminalis will be passing forward and laterally. From a depression in the center called the foramen cecum. So called the foramen cecum. What is this foramen cecum? In the embryological development, through the foramen cecum, the thyroglossal duct will be passing. So this will be indicating the commencement of the median thyroid rudiment as a thyroglossal duct. Okay, this anterior two-third, which is also called as the oral part, and the posterior one-third is also called the pharyngeal part. Okay, now this is called the, what is this? The sulcus terminalis. As this part is present in front, it is also called the pre-sulcus part. As this part is present posteriorly, also called the post-sulcus part, or simply the pharyngeal part of the tongue. Okay, now let us talk about this pre-sulcus or the oral part. Pre-sulcus part. So the pre-sulcus part, the mucous membrane will be adherent to the underlying muscles by means of lamina propria, and what is the most important feature is it will be having many number of the papillae. Large number of papillae are seen on the pre-sulcus part, that is on the dorsal surface of the pre-sulcus part. So what are the papillae? Now let us see each of the papillae in detail. Now the first one is the valate papillae. Valate papillae. So as we know, the tongue is like this, and the sulcus terminalis is in the V shape. So just in front of this sulcus terminalis, you can see some prominent papillae like this, called the valate papillae. They are usually 8 to 12 in number, present in V-shaped, a single row in front of the sulcus terminalis. Each papillae is a truncated and cone shape. What is this truncated cone shape? Like this. It is truncated cone shape and is surrounded by a circular sulcus. So this is the valate papillae. Now this is surrounded by the circular sulcus, this part. This is called the circular sulcus. This valate papillae, which is 8 to 12 in number, present in front of the sulcus terminalis. Now, it is truncated cone shape, will be having a very broader base, and it is surrounded by the circular sulcus. Okay, now let us go into the structure of this valate papillae. So like this it will be. This is the valate papillae. The walls of this, so I have told you, this is the circular sulcus and this is the valate papillae. This circular sulcus, in its walls, will be finding the taste buds. So in the wall, what will be finding? You'll be finding the taste buds like this. And over the outer wall of this sulcus, this is the outer wall of the sulcus is called the velum. And this circular sulcus, in the bottom, it will be receiving the ducts of the serous glands. It will be having the serous glands. So this is the valate papillae. This is surrounded by the circular sulcus. The wall of the circular sulcus will be having the taste buds, and in the bottom, the circular sulcus, it will be receiving the ducts of the serous gland. Okay, now this is about the valate papillae. Now the next papillae what we will be seeing is the fungiform. The fungiform papillae, they are the round and the red elevation that will be seen prominently at the tip and at the margins. So at the tip and at the lateral margins, these fungiform papillae are most prominent, and they will also be having the taste buds. Having the taste buds. Next, coming to the foliate papillae. The foliate papillae, they are usually rare in human beings, but it is more prominent in the rabbits. So whenever you see a tongue, where do you find it? Just in front of the sulcus terminalis, but in the lateral part. These are 2 to 3 number that are like a vertical mucus folds. How are they? They are like a vertical mucus folds. Okay, but they are more prominent in case of rabbits but not in the humans. Okay, next, going to the filiform papillae. The filiform papillae, they are very much numerous in number. Large number of the papillae belongs to this filiform. They are present in the dorsal surface, in the anterior two-third. Wherever you see, you'll be having this filiform papillae, except at the place where the fungi form, foliate, and the circumvallate is present. But the thing here is, it is not having any taste buds. Important point to be noted. The only papillae without the taste buds is the filiform papilla. Okay. Yes. Now this is the dorsal surface and the pre-sulcus part. Now let's go into the post-sulcus part. Post-sulcus part. What about this post-sulcus part? So the post-sulcus part is the one that is present behind the sulcus terminalis. Here the mucous membrane is attached to the underlying muscles by a loose connective tissue. If you recall what I've told earlier, in the pre-sulcus part, the mucous membrane is attached to the underlying muscles by means of a lamina propria, but here it is connected to the underlying structures, that is muscle, by the loose connective tissue. This loose connective tissue will be having the serous glands and also the lymphatic follicles. So the aggregation of the lymphatic follicles you'll be seeing in the post-sulcus part. These lymphatic follicles are nothing but the lingual tonsil. Okay, they are called the lingual tonsil. Will be having more number of lymphocytes. So each follicle will be having more number of lymphocytes. This is all about the post-sulcus or the pharyngeal part of the dorsal surface. Now let us come to the inferior surface. So the dorsal surface have completed. Now coming to the inferior surface. This inferior surface, it is covered again by the mucous membrane, but it will not have the papilla, unlike the dorsal surface. On the dorsal surface also you'll be having a mucous membrane in the anterior two-third, which is adherent to the muscles by the lamina propria, whereas in the posterior aspect it is adherent to the underlying muscles by the loose connective tissue. But here in this inferior surface it is also covered by the mucous membrane, but which is not having any sort of papilla. Now what are the features in the inferior surface? On the inferior surface, so let us draw the diagram as usual. So when if you consider this as the inferior surface of the tongue, so you can see the features called the frenulum lingua. So I'll just make like this. What is this frenulum lingua? Frenulum lingua, it is a median fold. This is the frenulum lingua. It is a median fold that is connecting the tongue to the floor of the mouth. So what is the frenulum lingua? That is present in the middle, so we call it a median fold that is connecting the tongue to the floor of the mouth. And the sublingual papilla are present on the either sides of base of the frenulum. See, this is the base of the frenulum. On the either side, you will be having the sublingual papilla. Into the sublingual papilla, you will be finding a opening called the submandibular gland opening. Okay, and on the either side of the sublingual papilla, you will be having a sublingual fold. This sublingual fold, inside the sublingual fold, you will be having the openings of the sublingual gland. Okay, now there is some clinical thing associated with this frenulum lingua. The shortness of the frenulum lingua when present, that will be leading to the tongue tie. So what is that? The shortness of this frenulum lingua leads to the tongue tie. So the tongue tie will lead to the disturbance in the speech, that is also called as ankyloglossia. This is about the frenulum lingua. And now, on the either sides of this frenulum lingua, you'll be finding some folds called the plica fimbriata. Like this, you'll be finding some folds on the either sides of the frenulum lingua, those are called the plica fimbriata. Between this plica fimbriata and the frenulum lingua, you will be finding some vein passing called the deep lingual veins. Called the deep lingual veins. These are all the things, features which you find in the inferior surface of the what? Inferior surface of the tongue. Now what is left over is the lateral margin. So lateral margin. So the lateral margin, it is also covered by the mucous membrane, and the palatoglossal arch is attached at the junction of the anterior two-third and posterior one-third. So this is the sulcus terminalis again, which will be dividing the tongue into anterior two-third and the posterior one-third. So the lateral margins, as usual, like everything is covered by the mucous membrane, and at the junction of this anterior two-third and the posterior one-third, you will be having the palatoglossal arch, in which you can find the palatine tonsil. Right? This is about the lateral margin. Okay guys, in this video we have spoken about the tongue, its location, its parts, tip, base, two surfaces, two lateral margins, and see the pre-sulcus part, post-sulcus part, different types of papillae, their location, and the post-sulcus part, and the inferior surface, and the clinical aspect. What was that? The tongue tie, ankyloglossia, shortness of the frenulum lingua that leads to the disturbance in the speech. And finally, the lateral margin, where you can find at the junction of the anterior to the posterior one-third the palatoglossal margin. Palatoglossal arch, in which you find the palatine tonsil. Okay, guys, in this video, this is all about we have talked. If you liked it, do not forget to share it with your friends, and please subscribe to my channel for more updates.